Good morning and welcome to our morning edition of Focus Live. I'm Dr. Hasnain Kermali, Chief Medical Officer here at St. Mary's Hospital in Waterbury, Connecticut. Each month we like to highlight one of our clinical departments, provide you some insights and an evaluation, a little bit of expert provider relief and what we're able to provide here at St. Mary's Hospital and in the Waterbury market. Today I'm very happy to welcome Dr. Irina Magidina, one of our fantastic Naugatuck Valley Women's Health Specialists, an obstetric and gynecology specialist here within St. Mary's Hospital and Trinity Health of New England. Thank you very much for joining us this morning.
Thank you for having me.
In the short time that you're with us, we'd like to go through a couple of things. Tell us a little bit about yourself and about your specialty, and then we'll dive in and talk about obstetrics and gynecology health for the greater Waterbury community and what you're able to provide for our patients here. So let's talk a little bit about you, Dr. Magidina. Irina, a little bit about yourself and why you chose obstetrics.
Sure. I've been here for about 10 years now, and I'm from this area originally. So I grew up in Connecticut, right in the Waterbury area.
Great.
I completed all my education and medical training right here in Connecticut, and I decided to stay in this area to practice. So I've been taking care of the women of Greater Waterbury for over 10 years now. Wow. Which is hard to believe. And you know, it was my first experience with a gynecologist that made me want to become an OBGYN. And it was as a young woman having that first conversation, kind of that sitting down, that connection to a gynecologist, having someone who made me feel comfortable. And it was that initial interaction that made me think, oh wow, you know, I think I could really do this. Because a lot of OBGYN is really about establishing a connection with a woman, making her feel comfortable, making her feel like she can open up to you, ask you any question in the world, because it really does get very personal. Right. And then establishing that connection and keeping it going through all phases of her life. And then being able to take care of her through a lot of what life throws her way, whether it's having a baby, having a surgery. It really is encompassing on a lot of levels.
Yeah, and that relates to that philosophy that we talk a lot about, our physicians here, is that keeping patient care at the forefront of what we do in our philosophies on shared decision making. So how do you roll that into your day-to-day practice?
Yeah, you know, it's a lot of what is important to me with the way I take care of patients is really being able to connect with a patient, having that rapport, making her a partner in her care, making her feel comfortable. Sure. Having the patient have a good understanding of her health, and a lot of what I do when I take care of patients is, I think, explaining healthcare and explaining on what's going on with a woman's body as things change and as she goes from one phase of life to another is very important, because women don't always get that education on a fundamental level, on a level that they can understand. Sure. And as a woman becomes a partner in her care and understands what's going on, then she can make informed decisions. And as she understands what options there are, then she doesn't feel like information is being thrown at her. Right. And she becomes more active in her care. And when women are active in their care, they can make decisions that are in their best interest, and they can be an active participant. And I think that's what shared decision making is all about. Yeah.
No, and that's very important when we talk about today, given the world we live in and the strength of the woman in the household. We talk about in healthcare, we say a lot that the mom is the CMO or the woman's a CMO in the house, and she's part of making those decisions for everybody else. But it's so important for them to make the decision for themselves as well as they're going through their own healthcare.
Right.
So let's talk about that first step. What are the characteristics or what makes finding that obstetric or OBGYN provider so important? What should women look for in a provider when they're going to see them?
I think the first thing is someone who will make them feel comfortable, someone who will take the time to get to know them a little bit, and someone who will speak in a way that they can understand and explain what's, what the purpose of the visit is, and what options are available to them, and who can teach them what is normal and what to look for as abnormal, and what the proper screenings are, and what the options are in their healthcare.
And then the question that's always that gets posed a lot is when's the right time for a lady to start that process of, okay, especially as they're growing up, young ladies and older teens and young 20s. When's the right time to say, I need an OBGYN provider that specializes in women's health?
Yeah, that's a very common question.
Yeah.
Because a lot of times my patients who have daughters ask, when should I bring my daughter in?
Sure.
And
a little bit of self-expression, because I've got a daughter too, so we're sort of, it was a fun car ride this morning into work, and I was explaining what we were going to do this morning.
Yes. So, my answer is usually, we see girls as young as they need to be seen. So when young girls start having periods, sometimes they have problems with periods, and questions come up that need to be addressed. And that's a good opportunity for a first visit. Not because there is screening that needs to be done, but really just to kind of explain what's normal and what may need to be addressed. And it doesn't mean that a girl that age needs to come every year. Sometimes it's just kind of an introductory visit, just to explain what a gynecologist can provide. It's a safe space. It's a place to ask questions that maybe are better sometimes answered by a professional than a mom. Sometimes girls feel more comfortable. Another opportunity for someone to come in is when they become sexually active. It's a good opportunity to discuss contraception, to discuss safe sex practices.
Sure.
Another opportunity to come in is when someone is ready to discuss having a family. So I think there are different phases of life that are opportunities to establish gynecologic care. And there's not one right time for everyone, but I think there are different time periods that pose these opportunities.
And let's talk about screening specifically for a moment. We've seen through the past couple of years that screening in general has gone down. So what are sort of the screening tools that you use for females, sort of age ranges, and what should they be thinking about as they go through, I guess, their annual women's health screening?
Yeah, I think it's a very valid point that screening has gone down, because a lot of times I see that there are opportunities to have medical care outside of a medical office. I see more and more patients getting birth control pills through online services. And as a result, some of that screening is being lost.
Sure.
And so it's important to remember that screening is still very important, because it's an access to care. And so screening for sexually transmitted infections is important for anyone who's sexually active. Cervical cancer screening is important for anyone 21 and over. But aside from that, a pelvic exam is still very central to what we do, and it's a way for us to pick up on abnormalities, and there's no way to get around that.
Right.
And we are really the doctors who do this. A primary care doctor doesn't necessarily do this. And a breast exam is still important. A mammogram is still important.
Right.
And without seeing a gynecologist, those things may not be getting done. A lot of times we see women who are in their post-reproductive years who stop seeing a gynecologist. And they think, okay, well, I'm seeing my primary care doctor, and that may be adequate, but it's not always adequate, because they may not be getting their pelvic exams done anymore.
Right.
So I do want to stress that a pelvic exam, cervical cancer screening, if it's still age appropriate, a mammogram, a clinical breast exam, these are still very important elements that sometimes get missed.
Yeah, so let's talk about that screening age. What are the ages for cervical screening? What's the age for breast screening and the pelvic exam as well?
So pelvic exams, we start at age, well, really when a woman is sexually active.
Okay.
Cervical cancer screening has been a changing thing.
Yes.
And right now our guidelines are that we start at age 21, and we'll screen between the ages 21 and 30 with a pap smear every year. After age 30, add to the pap smear a screening for HPV.
Okay.
And HPV is really, I look at it as a precursor to cervical cancer.
Sure.
So it adds to that cell-based screening. And if the cervical cancer screening, so the pap smear and the HPV are negative, then we space those out anywhere between 3 and 5 years. But that doesn't mean that the pelvic exam becomes less frequent. So that should still be done every year. And sometimes that's the missing piece of the puzzle. So a woman thinks that, oh, I only need a pap every 3 to 5 years, so I don't need to come as often. But that's not true.
Right. So it really does require a specialist in my mind, because those nuances of which screening, how to go about doing an appropriate screening, and screening is only as good as the screener. So if it's not done as appropriate, of course you're doing it all the time. So that's one piece, but it is an interesting dynamic because cervical screening is different than the pelvic exam.
Correct.
And so what are you looking for during the pelvic exam that's different there?
There are a lot of components to the pelvic exam. We're not only examining the skin of the external genitalia, we're looking at the intervaginal walls, we're looking at the cervix itself. We're feeling the pelvic organs, so we're feeling the uterus, the ovaries, the other structures in the pelvis. We're looking for size abnormalities. We're looking at the texture. I mean, does the cervix bleed when you touch it? That can be an indicative thing. So it really does require an experienced examiner. It's not just the pap smear anymore.
And the goal, of course, of screening is to find problems before they become bigger.
Exactly.
So that you can address them at an earlier stage. If it's cancer, God forbid, that's something you can address early on, as opposed to once it's beyond where it can be managed appropriately.
Exactly. And it's really the gynecologist who does it.
Yeah.
It's
and so what about some of the other subspecialties that we've brought on? We've brought on urogynecologists as well. Dr. Wan and Dr. Moss. What type of conditions would they treat as well?
So urogynecologists they're subspecialists of gynecologists. So we look at they're pelvic floor specialists. So they specialize in pelvic floor and reconstruction of the pelvic floor. So these are specialists who deal with pelvic floor prolapse, urinary incontinence, fecal incontinence sometimes. And the exciting thing is that they're kind of few and far between. So in Connecticut, there are relatively few places that you can see a pelvic floor specialist.
Right.
Sometimes general gynecologists do this type of surgery, but it really does require special training. And outcomes are directly proportional to a surgeon's volume in many cases, and this is one of them. So previously, we would have to send a patient to Hartford, to New Haven, to see a specialist like this. But to have someone right in Waterbury is really phenomenal, because a lot of times you need frequent visits. And to have someone, I mean, they'll be practicing in Waterbury and Middlebury right here.
Yeah.
And then you can have the surgery right here at St. Mary's. That's amazing.
It is amazing when we think about the services that we're able to provide here at the hospital. And the specialty that we're able to bring right into our own backyard, really focusing on the community here in Waterbury, allowing that access through St. Mary's Hospital to be able to get that kind of specialized care, which normally you wouldn't typically find in a smaller community area.
And I think that's been our goal all along in our OBGYN practice, is to be able to provide this broad spectrum of specialized care, really anything that you would need in seeing an OBGYN right here in town.
Yeah. And so what other services or conditions does the OBGYN team offer?
So, I mean, really anything you can think of. I think the better question is, what don't we offer?
What don't you offer? Yes.
So we can do infertility screening.
Okay.
We have someone specialized in our office who can really work that up on a very high level. We mentioned the urogynecology piece. We have access to gynecologic oncology. So if there's a question of a gynecologic cancer, we have local access to that.
Sure.
We have access to maternal fetal medicine. We have all of the general gynecologic things too, right? In the office, we do colposcopy, we do LEEP, so management of abnormal pap smears. Right here at St. Mary's, we have robotic surgery, and so we can do very advanced gynecologic surgery as well.
And that's amazing from the GYN perspective. So let's switch gears, and I've always been amazed, even through my training with OBGYN, because it does seem to be like two specialties all merged into one.
Right.
So let's switch gears from GYN to obstetrics. What are some of the safe practices that we've been able to put together here for safe deliveries for our moms here?
I think having the right people in the hospital has been central to that. So we always have an obstetrician in the hospital at all times. So we have a board certified OBGYN hospitalist here 24/7, which is amazing. So when a woman comes in with an emergency, you don't have to wait for someone to get here.
Right.
And that is central to the safety piece.
Sure.
So there's someone here to see that patient as soon as she gets here. There's an anesthesiologist in-house at all times. There is a pediatric physician assistant at all times. We have a 24-hour NICU available. And we have fantastic nurses.
Yes.
So really, we have it all covered.
And that's another piece of the puzzle that I wanted to get into, because not only, and you've talked about this before as well, but there's another safety piece for moms after delivery that you've been able to bring in with the postpartum hemorrhage and how you're managing that. Can you tell us a little bit more about that system?
So postpartum hemorrhage is probably the number one cause of maternal mortality. And here at St. Mary's, we've been, I think, pioneers in managing this. So we were the first hospital to utilize the JADA system in management. So the first hospital in Connecticut, I should say, to utilize the JADA system in managing postpartum hemorrhage. So it's a device which is placed into the uterus if a woman is hemorrhaging, or even, I've actually used it in someone at high risk for hemorrhage in trying to avoid that hemorrhage in the first place. Because why wait till someone's bleeding?
Why wait?
We can avoid it from happening and prevent a blood transfusion. That's a fantastic thing. It works very, very well, and I think we've always tried to be cutting edge, even though we're not a big academic center. We're not, someone with a huge name who you might think of being at the forefront, but we really try. And I think we've been very successful at that.
And I think that's a remarkable thing. And October, of course, being Breast Cancer Awareness Month, so screening is very important. October, of course, is also Infant Loss Month, in remembering those children, unfortunately, who were lost as infants. And those pieces of safety within the hospital, screening that we're able to provide, it all ties back to this concept of focusing on the patient. And I love you mentioned preventing something before it even happens. You're trying to think ahead. We're not trying to be reactive. You're trying to be proactive in the approach to managing patients' health.
Right.
Which I think is where that next level of medicine needs to go. In my mind, it's let's get to an area where we don't have to deal with somebody who's sick.
Right.
Let's help them when they're healthy.
Right, exactly.
So the last question I want to ask is sort of that nugget for patients. What's one thing you wanna leave our patients to say, hey, remember to do this, if anything, with your health going forward?
I think see a gynecologist. Find an OBGYN who you trust and will see yearly, because I think OBGYNs can be a woman's portal to healthcare in a lot of ways. Sure, we're not technically primary care, but we can serve as a woman's portal to care, and we can provide very important screening and also really guide a woman through all her stages of life in a very unique way. So I think establishing a relationship with an OBGYN is a very central part to a woman's life.
That's beautiful. So I want to thank you very much. For all the women out there, definitely let's connect with your OBGYN providers. And I want to wish you all a great day for the day. Stay tuned, and we'll see you on our next Facebook Live. Thank you all very much.
Thank you. Thank you.